Hi, my name is Tomer Mark. I'm an assistant professor of medicine at Weill Cornell Medical College in New York City. I'm here at ASH presenting the results of the CLAPT trial. CLAPT is clarithromycin, pomalidomide, and dexamethasone, and this was a study done in relapsed refractory patients with multiple myeloma. Patients with multiple myeloma who have relapsed after prior bortezomib and lenalidomide are faced with few choices for the therapy. Although carfilzomib and pomalidomide have been approved by the US FDA, it is unclear what the optimal dosing of these drugs are. We did a single-arm phase 2 prospective study looking at the combination of clarithromycin, pomalidomide, and dexamethasone for the treatment of relapsed multiple myeloma patients who had already progressed after prior lenalidomide therapy. We chose to combine clarithromycin with pomalidomide and dexamethasone based on the excellent results from the prior BIRD study, which was clarithromycin, lenalidomide, and dexamethasone. In that study, the addition of the clarithromycin was found to prolong the time to progression for patients on lenalidomide and dexamethasone by nearly 100%. So we decided to add the clarithromycin to the pomalidomide to see if we would obtain similar results in a relapsed refractory population. Patients were eligible to enroll into the CLAPT trial if they have had 3 prior lines of chemotherapy, one of which must have included lenalidomide. It did not matter whether patients were refractory or simply relapsed to either lenalidomide or to bortezomib. Patients had to have adequate performance status, had to have adequate organ function as well. Patients who have had prior autologous stem cell transplant were also eligible to go onto this trial. This is an interim report of the first 114 patients to enroll into the study with a median follow-up of 10 months. The side effect profile encountered in this study was very similar to the side effect profile encountered for pomalidomide and dexamethasone alone, mainly being fatigue, myelosuppression, and an increased rate of upper respiratory infection. Surprisingly, response to the combination of clarithromycin, pomalidomide, and dexamethasone was around 60%. Which is double that seen in the pomalidomide and dexamethasone alone patients previously reported by Richardson et al. The time to progression and progression-free survival were also doubled compared to pomalidomide and dexamethasone alone. Our study reported a progression-free survival of 8.6 months. The MMO2 study of pomalidomide dexamethasone alone reported a progression-free survival of around 4 months. As we continue to complete accrual of this trial, next steps include investigating the role of clarithromycin in combination with the IMiD drugs and a future phase 3 randomized trial.